Hello, my name is Jones, and today we are going to look at a surgical condition, trachoma. So, in looking at trachoma, we are going to look at the introduction, definitions, causes, pathophysiology, clinical features. We are going to also look at the risk factors, transmission, whole grading system of trachoma. Okay, Maclaurin's classification of trachoma, diagnosis, management, complications, and prevention. Trachoma is a disease of the eye that is caused by infection with bacterium Chlamydia trachomatis. Okay, so Chlamydia trachomatis is the causative organism of trachoma. So that's where the word trachoma is coming from. So it's a disease of the eye that is caused by infection with uh, Bacterium Chlamydia trachomatis. It is a public health problem in many countries and a cause of blindness in most instances, which may be irreversible. Based on the March 2019 data, 142 million people live in trachoma endemic areas and are at risk of trachoma blindness. Over time, scar tissue or ulcers can form that lead to blindness. Trachoma is the leading cause of infective blindness, that is globally. Okay, and a lot of people, millions, are affected by this. It is associated with poor hygiene and inadequate sanitation. Recent estimates show about 59 countries are endemic, and India has the high burden. Trachoma is the world's leading cause of preventable blindness or infectious blindness that is seen. So, in trying to define trachoma, we can also look at it as a disease of the eye that is caused by infection with bacterium Chlamydia trachomatis that is characterized by chronic inflammation of the conjunctiva. So, in this definition, we have given out the characteristic nature of the disease, which is bringing about chronic inflammation of the conjunctiva. Otherwise, trachoma can also be looked at as a chronic keratoconjunctivitis that is caused by Chlamydia trachomatis. So this is trying to define trachoma with the anatomical parts that are affected. Trachoma can also be defined as a contagious bacterial infection of the eye that is caused by Chlamydia trachomatis that is characterized by hard pustules, inflamed granulation of the inner surface of the eyelids, inflammation of the membrane, and subsequent involvement of the cornea. What is the cause of trachoma? The cause of trachoma is Chlamydia trachomatis. The bacterial responsible for trachoma is Chlamydia trachomatis. There are different types of Chlamydia trachomatis. There is type A, B, and B, A, and C that may cause blinding trachoma. Other types are D to K and are associated with sexually transmitted chlamydia infection. The incubation period of trachoma is 5 to 21 days. Onset subacute, but on massive outbreaks, this it can be more or it can be seen. Let us now look at the pathophysiology of trachoma. Trachoma is a disease of the eye which can be treated by antibiotics and prevented by good personal and environmental hygiene. Now, when there is a repeated episodes of reinfection and chronic intense conjunctival inflammation, it may occur because of active trachoma infection, which may lead to tarsal conjunctival scarring. The scarring distorts the upper tarsal plate, and in some individuals, it may lead to entropion and trachiasis. The end result includes corneal abrasion, corneal scarring, and opacification, and ultimately blindness. So after infection with chlamydia trachomatis, it may lead to tarsal conjunctival scarring and inflammation. Okay, to some it may cause interruption, and others it may lead to opacification, abrasion within the cornea, and this is what may lead to blindness. What are the clinical features of trachoma? There can be watering within the eyes. Okay, watering can be seen. Then, apart from watering, there is a foreign body sensation that is felt by the person suffering from it. There can be redness of the eyes. There can be mucopurulent discharge from the eyes. There can be mild itching and irritation of the eyes and the eyelids. There can be eyelid swelling. There is a photophobia or light sensitivity. There is also blurring of vision and mild eye pain. What are the risk factors to trachoma? Risk factors increase your risk of that is contracting a trachoma. This may include poverty. Trachoma is primarily a disease of extremely poor population in developing countries. Crowded living conditions, people living in crowded living conditions are also predisposed, apart from the issue of poverty. People living in close contact are at greater risk of spreading infection that is to do with crowded living condition. Then with poverty, because you are going to live in a poverty extreme condition, and that is to do with shelter and the likes. Then poor sanitation. Poor sanitation or sanitary condition may lead to lack of hygienic places such as and may lead to lack of hygienic intense use of places, and you may have things such as unclean areas of disposal of feces, or which may eventually help in the spread of diseases. Then the other predisposition to trachoma is the age. In areas where the disease is active, it's most common in children, that is ages 4 to 6. Then the other predisposition is sex. In some areas, women rate of contracting the disease is 2 to 6 times higher than that of men. Then the other predisposition to trachoma is flies. People living in areas with problems controlling the fly population may be more susceptible to infection. Then the other predisposition is lack of latrines. Populations without access to working latrines, which is the type of a communal toilet, may have a higher incidence of the disease. Okay, so now let us look at the risk factors. To simplify the understanding of risk factors, we are going to call them the 6 Ds. That is, risk factors include dry, dusty, dirty, damp, discharge, and density. Okay, so these are the risk factors or risk predisposing factors. So predisposing factors like age, more infants or children, then sex, more common in females, then dry and dusty environment, then low socio-economic status or an hygienic condition or lack of sanitation. So to quickly understand the predisposition, you can think of the 6 Ds. That is the dry, dusty, dirty, damp, that is to do with feces and the likes, then also the discharge or the density or crowding. So predisposing factors like age is not in the Ds, but age more to do with infants, and then when you talk of sex, more common in females, and then dry and dusty environment because of dust and poor condition. Then low socioeconomic status are to do with poverty, which may lead to living in an unhygienic condition and lacking of sanitation. Okay, so dirty faces and flies may cause trachoma. So here you have just a kind of demonstration here where because the face is dirty, it attracts the flies, and you see that the flies now bring the infection. Okay, flies are now the source of infection, bringing that. Okay, then fight trachoma by washing your face, because if your face is dirty, the infection may come, and so you need to wash your face. Okay, then spread of infection. So infection can spread by direct contact, that with the airborne or waterborne infections. Vectors like flies, that is the musca domestica kind of flies. So there you can have issue of flies, and then material, which is most important formite. That is the material through which this infection may settle. So you can split the infection. Okay, so most important that is domestica there. So the transmission of trachoma. Transmission of trachoma, we can talk of 5Fs. That is, when your fingers touch these surfaces that are dirty, you touch your eyes, so fingers. Flies, they move to an area which is contaminated, and they come to your face. Okay, then face. Okay, we don't wash your face, you are predisposing yourself to the transmission of that. Then no proper way of disposing feces also predisposes to trachoma. Then the issue of fomites, which is contaminated, predisposes to coma. Okay, so now let us look at World Health Organization grading system for trachoma. So we have trachomatous inflammation, okay, or trachomatous inflammation written as TF or follicular stage. Here, there is active disease. The first sign is the presence of follicles, which are small bumps formed by swollen lymph tissue on the lack of upper eyelid and sometimes extending to the top part of the eye. The presence of 5 or more follicles greater than 0.5 millimeters in size on the conjunctiva lining and also the back of the upper eyelid is considered a grade TF. No scaling, if treated properly, may result. So this is for follicular, where there is about 0.5 millimeters in size of follicles that may form. Okay, so the first WHO grading is trachomatous inflammation. So what is formed here is the follicle. So, or you call it the follicular. So there's active disease here, and the sign of presence is the presence of sign here. There are follicles, which are small bumps that are formed by the swollen lymph tissue. So the lymph are trying now to protect the infection from going to other areas, so they become swollen. Okay, that is at the back of the eyelid, and sometimes extending to the top part of the eye. So the presence of 5 or more follicles greater than 0.5 on the conjunctiva lining of the back of the upper eyelid is what is considered grade TF or trachomatous folliculitis. No scarring, if treated properly, may be seen. Okay, so here is just a diagrammatic presentation of a TF stage. Okay, so there are some follicles that have been formed here on the lymph nodes. Okay, all right. So now the next grade is trachomatous inflammation intense or TI. Okay, so the first one was TF, trachomatous folliculitis. Then trachomatous inflammation, which is intense. Okay, severe disease, and here it's a severe disease and needs urgent treatment. The next phase is swelling or inflammation of the conjunctiva that obscures 50% or more of the view of the normal deeper blood vessels of the conjunctiva. We see tarsal vessels and papillary which are present. Okay, so the diagrammatic presentation is like this. You see the prominence of this inflammation here, the tarsals and the likes. Okay, so this is in trachomatous intense. So TF, then TI. Okay, follicles, then inflammation. Okay, so what we are saying is when you look at stage 1, the trachomatous inflammation here is the follicular phase, the active disease. the active disease part, you see that follicles are formed. Then when you come to the trachomatous inflammation intense, okay, here this is a stage of severe disease, okay, and it needs urgent treatment. The next phase is swelling of the conjunctiva that obscures that is 50% or more of the view of the normal deeper blood vessels of the conjunctiva. So this is you can see the inflammation here. Then we have trachomatous scarring, okay, that is a TS. Here we see intensive infection. So in the TI, intense, we saw severe infection. Now here we are seeing intensive infection, and this scarring begins to happen. After inflammation, scarring start to take place. So we are saying there is intensive infection. Bands of scar tissue form within the conjunctiva, lining the inside of the upper eyelid. Visible fibrous white bands also may be seen on the tarsal. So this will appear like this, and then you can see the tarsal here and the white things there that you are seeing because of scarring. Okay. Then the next part is trachomatous trachiasis. The bands of scar tissue tighten, causing the lid margins to turn inward. Okay, so when they turn inward, that is what we call entropion, and the eye rushes to rub against the eye. That is it. When the eye rushes against it, we call that trachiasis. So over time, this rubbing results in abrasion of the cornea and the clear central covering of the flank of the eye. Okay, so after the scarring, you now start seeing the bands of the scar tissue that tightens, and we see entropion. Entropion results into trachiasis, that is the rubbing of the eyelashes on the cornea, irritating the cornea. So now these eyelashes are rubbing the cornea, and this is what we necessarily see. Okay, then there's corneal opacity. Okay, this corneal abrasion can lead to infection, ulcers, and also ultimately may lead to opaque scarring that blocks light from entering the eye, leading to blindness. Okay, so the representation from trachomatous inflammation, follicular TF is like this here, the demonstration. So the part one is more to do with the inflammation where follicles have formed. So the presence of 5 or more follicles in the upper tarsal conjunctiva, and the follicles are round swelling that are paler than the surrounding conjunctiva. Okay, they appearing white there, the gray or yellow, then the follicles must be at least 0.5 millimeters in diameter. So this is the TF stage. After the TF is trachomatous inflammation intense. Okay, here we see pronounced inflammatory thickening of the tarsal conjunctiva that obscures more than half of the normal deep tarsal vessels. The tarsal conjunctiva appears red, okay, rough and thickened. Okay, so there are usually numerous follicles here, which may be partially or totally covered by the thickened conjunctiva. Okay, so that is within trachomatous inflammation intense. Then trachomatous scarring. Here we see the presence of scarring in the tarsal conjunctiva. Okay, scars easily visible as white lines and bands or shots within the tarsal conjunctiva. They they are seen as fibrous appearance, and then the scarring, especially diffuse and fibrosis, may obscure the tarsal blood vessels. So this is in the tarsal scarring. Okay, so in the tarsal scaling, you see the whitish lines there and the lights. Then we see trachomatous trachiasis, that is TT. at least one eyelash labs on the eyeball, then it qualifies to be called trichiasis. Evidence of recent removal of untined eyelashes should also be graded as trichiasis. Then the last stage within the whole classification is the corneal opacity. So this is easily visible corneal opacity that is over the pupil. The pupil margin is blurred viewed through the opacity. Such corneal opacity may cause a significant visual impairment or loss of sight, up to let's say 6/18 or 0.3 vision loss, and therefore visual acuity should be measured if possible. So we have a corneal opacity there. So we have these stages, that is stage 1, 2, 3, 4, and 5 according to WHO. Then when you look at Maclaurin's classification, in Maclaurin's it just gives them a stage 1, 2, 3, and 4. So in Maclaurin's classification, stage 1, we have incipient trachoma or stage of infiltration. Here you see hyperemia or increased blood supply, that is of pupebral conjunctiva and the immature follicles. Then stage 2, okay, of fluid infiltration. Here we see mature follicles, papillae, and progressive panas. Then in stage 3, we see cicatrizing trachoma, which is a stage of scarring. Then stage 4, we see healed trachoma, which is a stage of sequel. Let us now look at the diagnosis of trachoma. It requires at least two of the following clinical features: follicles on the upper tarsal conjunctiva, limbal follicles and their sequelae or the heavy pits. Then it also requires typical tarsal conjunctival or scarring. Then it may also require vascular panas most marked on the superior limbus. That is the way you are going to diagnose. There are also differential diagnoses to trachoma, which may include allergic or venal conjunctivitis, bacterial conjunctivitis, or follicular conjunctivitis. So this is a sign of conjunctivitis here. Okay, so with that discussed, let us now look at management of a patient with a trachoma. Okay, so the treatment of active disease and then the sequela and the prevention. So the aim, prevent complication to prevent the spread, okay, and also to give the needed treatment. So treatment of active disease, they give antibiotics, okay, that is oral azithromycin 1 gram start or 20 milligrams per kg body weight. Then tetracycline or erythromycin 250 milligrams QID for 4 weeks. Doxycycline 100 milligrams BD for about 4 weeks can be given, and the topical based for individual cases, okay, can be given, and systemic side effects can also be seen when such are given. We can also give 20% sulfacetamide eye drops, that is 3 times a day, with 1% tetracycline ointment at bedtime for 6 weeks. Other topical antibiotics for secondary bacterial infection include the lubricants, analgesia, blanket antibiotic therapy or intermittent therapy. Okay, then in endemic areas to control intensity and severity. So the regimen of tetracycline ointment can be given for even up to 6 months. Okay, can be given a BD for 7 days or can be given for 4 months, like 6 months. Let us now look at trachoma prevention and control. Prevention of trachoma-related blindness require a number of interventions. The World Health Organization and their partners endorse the surgery, antibiotic, facial cleanliness, and environment strategy of trachoma control. Okay, so that is it, the safe. That is recommended. So that is surgery, antibiotic, facial cleanliness, and environmental strategy. So the safe strategy, that is S for surgery in the safe strategy, stands for tracheasis surgery. Eyelid surgery to correct tracheasis is important in people with tracheasis who are at high risk for trachomatous visual impairment and blindness. Eyelid surgery to correct entropion and or tracheasis may prevent blindness in individuals that is who are at immediate risk. Then within the safe strategy is A, antibiotic. The World Health Organization recommends two antibiotics for trachoma control, that is oral azithromycin and tetracycline eye ointment. Azithromycin eye drops have also been shown to be very effective in treatment of trachoma. Azithromycin is better than tetracycline, but it is more expensive. So azithromycin is the drug of choice because it is easy to administer as a single oral dose. Its administration can be directly observed. Okay, compliance is higher than the tetracycline and can actually be measured, whereas with the home administration of tetracycline, the level of compliance is unknown. Azithromycin has high efficacy and low incidence of adverse effects. Okay, so when adverse effects occur, they are usually mild or gastrointestinal upset and rash, okay, which are most commonly adverse effects like in other antibiotics. So those can be seen. So infection with C, trachomatis or type C, occurs in the nasopharynx. Therefore, patients may reinfect themselves if only topical antibiotics are used. So the safe strategy E is for environment. So the general improvement in personal and community hygiene are almost universally associated with the reduction in the prevalence and eventually the disappearance of trachoma. Environmental improvement activities include the promotion of improved water supply and also improved household sanitation, particularly methods for safer disposal also of human feces. So there, on just trying to emphasize on a safe. So we are safe of the safe strategy, surgery for that is collecting tropion and tracheasis antibiotic. Okay, we have Pfizer donated Zithromax there to treat and prevent active infection. Then facial cleanness here and the video here trying to wash his face to avoid attracting the flies to the face. Then environmental change, that is to increase access to clean water and sanitation. Okay, so you can also engage in activities that can help promote and prevent complications of trachoma in your community. Okay, so now let us now look at complications of trachoma. One episode of trachoma caused by Chlamydia trachomatis is easily treated with early detection and use of antibiotics. Repeated or secondary infection can lead to complications, including scarring of the inner eyelid, okay, eyelid deformities such as an inward folding eyelid, which we call entropion, or ingrown eye rashes, which we call tracheasis. There can be corneal scarring or cloudiness, a partial or complete vision loss. Then let us look at the National Trachoma Control Program and trying to control. So this one was launched in 1963. Safe strategy training at root level, health education, and the likes, global elimination of trachoma, say by 2020, was launched by the World Health Organization. This was to eliminate trachoma as blinding disease, okay, internationally. So in the prevention, in the prevention of trachoma, if you have been treated for trachoma with antibiotics or surgery, the infection is always a concern. So for your protection and for the safety of others, Be sure that family members or others you live with are screened and, if necessary, treated for trachoma. Trachoma can occur worldwide, but it is more common in the Middle East, North Africa, Sub-Saharan Africa, and areas of Southern Asia and China. When in regions where trachoma is common, you can take extra care in practicing good hygiene, which can help prevent infection. So, what are some of the things that we need to do in preventing trachoma in these areas? That is, proper hygiene practices may include face washing and the hand washing. Keeping faces clean may help break the cycle of reinfection. Then controlling flies, reducing fly population can help eliminate a major source of transmission in the trachoma. Then proper waste management, that is, properly disposing of animal and human waste can reduce breeding grounds for flies. Then improved access to water. Here, having a fresh water source nearby can help improve hygienic condition and sanitation, hence eliminating trachoma. Then, no trachoma vaccine is available, but prevention is possible. The World Health Organization has developed a strategy to prevent trachoma with the goal of eliminating it by 2020, and 2020 has passed. This is the recording is being done in 2020, okay, which is titled as Safe Strategy. Otherwise, for prophylaxis, there can be maybe some drugs that have been devised there which you can look at, but it's important to practice good personal hygiene and the environmental hygiene. You can also give health education on trachoma prevention. You can also use towels and handkerchiefs. Okay, so use of health education on trachoma prevention can help also reduce the incidence of trachoma. Good personal hygiene and environment can also improve community incidences or reduce the incidences of trachoma. Okay, so you can also avoid use of common towels and handkerchiefs. Okay, because if you discourage using this, you'll see that there will be reduced incidences. You give access to clean water. Okay, because dirty water increase incidences. Fly control, you can do insecticides, okay, and good sewerage garbage disposal, window screen protectors. So these can be done to avoid the flies. So these they are going to reduce the instances of trachoma. Then prevention of recurrent infection here, all family members can be screened and treated. Then there's early detection and the treatment of trachoma. So there you have it. Today we're looking at trachoma, and we looked at different components and different definitions of trachoma. We have looked at SAFE from the Macallan and the World Health classification of trachoma stages. So please, we have also talked about different ways in which you can prevent trachoma. So thank you very much, and keep studying.